In economics, a public good is defined as a commodity or service that is provided to all members of a society, usually administered by governments and paid in collective through taxation. Public goods are said to be non-rivalrous and non-excludable. Non-rivalrous indicates that the goods do not diminish in supply when there is an increase in consumption. This means that non-rival goods can be consumed or possessed by multiple users at the same time. Radio and television shows are great examples of non-rival goods. Non-excludable indicates that the good is available to all members of a society. It is practically implausible to exclude a certain individual or group of individuals from the access of consuming public goods. Examples of non-excludable goods are public roads and clean air. Negative externalities may occur when one induces pollution, harming neighboring individuals and society, while using public goods. In addition, market failures occur when the price mechanism fails to allocate goods and services efficiently in the free market. Furthermore, free riding may occur in the distribution of public goods. It occurs when a member or a group of members of society enjoys unlimited access to public goods without paying for them through taxes. In Malaysia, local governments play a crucial role in making decisions on the allocation of public goods and services. During the COVID-19 pandemic, the by-then Malaysian Prime Minister Tan Sri Muhyiddin Yassin suggested to make vaccine a public good that is available and affordable to all. Healthcare market failure emerges when the price of health insurance is beyond affordable to many members of society. In a competitive market, healthcare will be underprovided and the marginal social benefit from healthcare exceeds the willingness and ability of consumers to pay for it. In Malaysia, inequity in public healthcare system is displayed in geographical location and accessibility. The inequity has exacerbated the COVID-19 pandemic as the healthcare system in Malaysia is at the verge of collapse, recording the highest death rate per capita among ASEAN countries. Underprovided healthcare leads to the shortage of public medical specialists and overcrowded government clinics and hospitals. Despite spending approximately 20% of its budget distribution for education purposes years by years, Malaysia struggles to attract investors and FDIs due to inferior quality of education. The new economic policy as an affirmative education for the Malays creates an unfair environment for the non-Malays community. When inequality occurs, individuals that are affected are less likely to engage in social activity or civic participation, emitting an early sign of market failure. In Malaysia, national policy on the environment is established for sustainable economic growth while preserving the soundness of environment. Besides, the Environmental Quality Act 1974 was enacted to establish a legal mechanism to punish reckless polluters that impose harm to the environment. However, the enforcement of such laws and policies is deemed weak to regulate illegal pollution. For instance, long-lasting water cuts due to illegal chemical dumping into the water purification system in highly populated Klang Valley in September 2020 spurred calls for environmental law reinforcement. In Malaysia, there are only about 1.3 million taxpayers out of the total population of 33.5 million, amounting to a relatively insignificant 4% of the total population. Public infrastructure is overprovided, rendering a market failure with entailment of free riders, as the benefits of public infrastructure enjoyed by the members of society is not correspondence to the maintenance cost of it. The Malaysian government could reform its public healthcare funding policies by allocating more resources to the healthcare sector to ensure a more efficient and transparent financing to meet public needs. The fund allocated could be used to further enhance the welfare of contractual medical personnel under the current wage scheme that sees more portions of emoluments tilt towards contractual workers. This will encourage more experienced doctors to remain at district hospitals or health clinics, which improves accessibility to public healthcare. Besides that, government intervention is very much needed in curbing environmental pollution. Referring to the diagram, the Malaysian government increasingly allocates fund to environmental protection from RM 2,243.6 million in 2014 to RM 2,885.3 million in 2019. Moreover, in the effort of availing public education to more members of society, the Malaysian government has increased its allocation to public education sector. According to Department of Statistics Malaysia, the total expenditure spent on education is increasing gradually from RM 44,878.8 million in 2017 to RM 55,752.1 million in 2019, amounting to a 24.23% increase in 2 years. Finally, the Malaysian government is keen to transform Malaysia into a regional digital economy hub while incorporating with AI technology, the Internet of Things, blockchains, the big data analytics and other digital adoptions. Referring to the chart, Malaysia is quite competent in the digital infrastructure market in the Asia-Pacific region due to its prompt support from the government and promising market demand. Public goods might be challenging to provide because there is little incentive for people to purchase them. Private contributions to organizations like the World Wildlife Fund, National Public Radio, and others are not the only ways to support charitable causes. Around 2% of the US GDP is now given to charity groups, with religious causes receiving most of these donations. The Rekindling Reform effort has looked at the healthcare systems of 4 nations, Canada, France, Germany, and the United Kingdom. These nations have succeeded in providing their residents with high-quality healthcare while maintaining relatively affordable costs by avoiding market failures that might result from privatization and market-based approaches to healthcare. The 12th Malaysia Plan, 12MP, places a strong emphasis on shared prosperity with a particular attention on social well-being, environmental sustainability, and economic empowerment. Public goods projects including those promoting affordable housing, environmental development, healthcare, and education are included. Firstly, the development of renewable energy. To lessen the nation's dependency on fossil fuels, the government might invest in renewable energy sources including solar, wind, and hydropower. For instance, the generation of renewable energy has also increased significantly in several Pacific Island nations including the Cook Islands, Fiji, and Vanuatu, with renewable energy projects accounting for 20% to 40% of total energy output and striving to achieve 100%. Next, digital infrastructure. Having dependable internet connectivity is crucial given the growth of distant work and digital communication. To guarantee that all Malaysians have access to high-speed internet, the government might invest in developing digital infrastructure. Furthermore, open-source technologies and digital public goods, which may quickly address digital concerns, are priorities for Singapore. The government of Malaysia has recently raised public consumption by 21.7%, mostly because of higher spending on remuneration, supply, and services. The government also controls public monies collection, custody, and distribution through established government-affiliated investment firms, GLICs. The Malaysian government understands the value of public-private sector cooperation in delivering public goods. The Public-Private Partnership Unit, UKAS, and the Registrar of Societies are only a couple of the policies and programs the government has put in place to encourage collaboration, ROS. NGOs may work with the government to provide public goods and take part in community development initiatives. In Malaysia, a number of NGOs work with the government to promote educational equity and equality. The G02 School is one such NGO. For the most part in cooperation with the Malaysian government, the G02 School offers basic, intermediate, and university education possibilities for children who are refugees or asylum seekers. Next, in Malaysia, a number of NGOs work with the government to deliver healthcare services. One such group is the Relief and Response Team of the Islamic Medical Association of Malaysia, which collaborates with the Orang Asli Outreach Group to offer healthcare services to underserved communities. The Malaysia Mental Health Association is another group that focuses on mental health and works with the government to offer assistance. These NGOs' freedom from governmental rules and regulations is one of its advantages because it enables them to offer their target communities more flexible and specialized healthcare services.